Hey everybody, Vince Burke here talking about the COVID-19 homecoming. We've done session lesson PT in your home, 1, 2, 3, and now 4. So we have to think, when are we going to discharge the mask? And this, I look at this as no different than if somebody is in a cast, when are we going to take the cast off? If someone's in a walker, using a walker in rehab, when are we going to go from a walker to a cane? From a cane to a little bit of a brace or something like that, and then of course return to sport. So, you know, we have to just start to think, when could the patient, right, the family member, come out of isolation? And kudos to the family members and all the families that have been collaborating on caring for this person over the last couple weeks. And everybody's confronted like, well, what's next? What's next? Well, first things first is that the caregiver needs to talk to the doctor. And I know that's sometimes uncomfortable because, you know, you're involved in the medical care system for this person, but you need to talk to the doctor and have conversation. Conversation is simple. First of all, you want to be able to have dialogue between patient, yourself, how they're feeling, and all those subjective kind of questions that we have. And then, you know, about their fatigue, any aches and pains. Of course, you've been always monitoring the fevers. And the big thing is nutrition. You know, sometimes when our nutrition is suppressed, you know, if that bounces back, we're pretty good. Hydration, or they get into more of a routine where they get up in the morning, they look forward to getting out of the clothes, you know, that they slept in. They're getting more energy for self-care, hair, makeup even. Where's my coffee, so on and so forth. So those are good signs that somebody wants to come out of this epidemic. But what we need to start to do is coordinate conversation with family members too. But everybody needs to feel safe with it and feel comfortable. And everybody's going to gauge it different. There's always a fear factor. We talked about that before. We only know what we know, but we have to seek a little bit more knowledge so that you are not playing this Russian roulette with this disease. But however, we have to still open up the gates a little bit and allow a little bit more freedom of motion. So if they've been in an isolated area, we need to think to expand upon the isolation area. No different than a child come home in a bassinet and you put them in a crib and then you put them in a bed. I mean, those are really important things to think about, the progression. And if we have that kind of mindset, this will make it easier. So if they're walking in a little area, open it up. If they're sleeping in this area of the house or whatever that's not bright, or they're not sitting in a room that has sunshine, the weather's going to change, and we need to actually invite sunlight in the house and have them more mobile. Once you start to do that, the fear factor goes down, their independence goes up, their confidence goes up, and the anxiety goes down. Those are huge, huge factors. Setting up a telehealth with the medical team is important. Having the people staying at home, make sure they're engaging into social media, such as, you know, the news, TV, and all that stuff, music, things that are not hospital-like or isolation-like. After that, as a family, right, we have to start to think, okay, who's going to start to come over? How are we going to do this? Same thing as the government has a system to open up in phases. Well, the family has to not only open up the living space for the home for this patient, but in more freedom of motion, but we also need to think about how we're going to interphase family. I wouldn't suggest a whole army come over. It has to be pockets a little bit. A family goes that has been responsible in isolation and quarantine as recommended. And then if you have this family over here who's COVID patient X with the other, and they've been in isolation, So that would be a good bridge to start, because you have two responsible homes that have been following the guidelines from the CDC and also the government. After that, we breathe, no different. And then we could think that, hey, another family can come in. So think of it as like you're penetrating, but another family. Definitely, by all means, you want to, if there are people in the family who have been out there and on the medical end of things. I know for myself, if I have, family members or around, I mean, I'm out here and I'm working every day. I'm seeing patients, telehealth, or whatever it is. So, of course, if you are in a setting where you're exposed, of course, you're practicing, what you need to practice. But still, you should be probably the last layer, if you will, to penetrate. And then I think that kind of ties things together for the early part of, June, June and July, and get things going. And then allow the person to go outside. Once you feel comfortable, you're going to start to feel less walking behind the person and cleaning, The good thing is that we all learn from this, that our homes are going to be definitely much cleaner and definitely, hopefully less hysterical about who, what, why, where, when, and getting crazy with everything. But I just want everybody to start to think of the last phase, right, which is independence, function in the household, getting back to life, a normal routine without that one family member caregiver there all the time. The other thing is that as you migrate into more independence at home, because everybody's getting cabin fever, of course, cabin fever, you want to maybe set up a communication line. The longer you leave that person at home, I highly recommend, a life alert system. The cell phones are charged. The house phone is there. Everything is, the shop is set up. Safety first. Make sure that nothing's left on the stove. Make sure that the meals are heated up already. So make the person feel that they're not a burden, but yet they're assisting in the transition between hospital, I'll call it, that's acute, subacute, which is isolation, and now chronic, that we've been out so long, and then of course return to life, sport, activity, and family. So let's all just kind of get together and say, what's the plan? What's the plan of mobility for independence? And it's going to take a little bit of coordination, conversation between you and the patient, family member and the doctor, and then of course the family. And then penetrate it and start breaking the isolation into integration of socialization for the household first, and then family members to the household, and then in the car and transporting it hopefully into a restaurant. So anyway, so until next time, Vince Burke talking on the fourth phase, return to life, sport, whatever it is, after COVID, homecoming is out of the house.